This conference will now be recorded.
Excellent. And if it's okay with you, Ed and Britt, I would love to start.
Great, thank you, Janet. Was there any, I didn't know if there were any board members that you wanted to mention before we got started, or?
Yes, I have Dorothy who has joined us. Good morning, board member, sir. How are you this morning?
I'm great. It's sunny here in Pendleton, Oregon, and I'm happy to be here and happy to excited about this topic, and just want to welcome everybody. I hope you gain some knowledge here and look forward to seeing you at the conference in September.
Thank you, board member, sir. We welcome all of you to Coffee with Nahara. For those who do not know me, my name is Janet Borland. I'm the Association Director for the National Native American Human Resources Association. And for those who are with us for the first time, Nahara is a tribal-led nonprofit organization focused on HR, profession, and tribal leadership. We are committed to members every day of the year as we truly understand HR and leadership. Historically, the association started as a grassroots effort with 4 tribes meeting to network and share personal challenges and solutions. The meetings evolved into conferences, and the membership grew into a formal Northwest and then a national association. We are now in our 27th year of existence and continue to advance and advocate for Native American tribes. We offer resources, including certification programs, webinars, annual conferences, and summits. And with that being said, we're going to be hosting a mental health awareness summit this May 11th and 12th at the Palms Casino in Las Vegas. And if you're interested, registration is open right now on our website. Please go to www.nahara.org to register. Today, we proudly present our Nahara partners, Ed Gonzalez, Strategic Account Executive, and Brittany Morris, the Director of Member Services at Renalogic. Today's presentation will focus on the prevalence of chronic disease in Native American communities and the importance of managing these conditions to improve health outcomes. We will explore the role of a member, coaching and health promotion in managing chronic diseases such as diabetes, cardiovascular disease, and chronic kidney disease. Renalogic nurses serve as member coaches, providing guidance and support members to better manage their conditions. Please utilize your chat box for any comments or any questions during today's session. We are recording today's session and will be available for your view this coming Friday at the Nahara YouTube channel. And if you are a Nahara member, Barbara Griffin, who's our Nahara Administrative Manager, will be notified that you attended today's sessions for THRP credits. With that being said, I would love to introduce to you to Ed and Brittany.
Thank you so much, Janet. Thank you for your support. Thank you to all the board members from Nahara and all the partners that are joining us today. I may be a little bit familiar to some of you folks. I've been joining Nahara conferences since 2019, as has Renalogic. We sponsor events. Looking forward to meeting many of you here in Arizona. I actually live about 5 minutes away from the Gila River community, so it's super convenient. This year's annual conference, I'm really excited to meet all you folks. And if you're coming in early, please reach out. We'd love to meet you folks over the weekend as well. So to get started, as Janet mentioned, we're going to discuss improving health outcomes. Before we get into the health outcomes or how do we improve them, definitely want to make sure that the audience understands, what is chronic kidney disease, how does it impact, so kind of really understand and kind of put a little bit focus on the actual concerns and challenges that affect tribal communities. So just a brief introduction on myself. We'll give an overview on the company. We'll talk about specifically how kidney disease is impacting Native American and Alaska Natives, and then kind of discuss how we approach it. My colleague Brittany, who leads a team of nurses and helps coordinate their care, will be speaking and providing some real life examples and stories of what that member experience looks like. So as I noted, Brittany, who's joining us, she's kind of the person and the nurses that she works with, and various folks from our care component. They're really the member focused folks. Those are the folks that are working with the members, with the actual community members that benefit from our programs. Myself, as strategic account executive, I work with many of your partners, the consultants that serve you, the underwriting organizations. I do know that there's very likely some partners that are on the call today. Appreciate you folks coming on. And I'll actually have a case study as well from an organizational level of the impact of our programs. And as Janet noted, if you have any questions as we go through the slides, feel free to put them in the chat box, and she'll let us know if there's questions that are coming up. So just high-level overview of what we do. We're a purpose-driven organization. Our goal is to help manage healthcare for members that are high risk, as well as help manage the costs related to dialysis that affects tribal communities. Today, Renalogic serves approximately 25 tribal governments and their enterprises. We provide care coordination, coaching, advocacy. Our primary goal is ideally to prevent members advancing to that end-stage renal disease. So we have programs that cover A to Z, everything renal, everything really focused on chronic kidney disease, but also the other disease states, other chronic disease states that do impact and advance chronic kidney disease. And we'll be speaking about those in a little bit more detail. So why do we do it? I think it's really important for us to understand the impact that chronic kidney disease has. And as much of an impact it has, very few folks tend to really know what it is. It actually affects approximately 37 million Americans. So about 1 in 7 Americans. Unfortunately, though, very few folks that do have chronic kidney disease are not aware of it. So about 1.5 million or so are aware of their chronic kidney disease, have a proper diagnosis, and over 35 million, it's estimated, aren't even aware that they have chronic kidney disease of some stage. Currently, there's about 750,000 Americans today on dialysis. The other factor is cost. So even before someone reaches end-stage renal disease, chronic kidney disease has a huge impact on health plans and their costs, costing health plans over $100 billion a year. And the average cost for self-funded plans, which I know many tribal communities leverage self-funded plans for their enterprises and for their citizens, also is incredibly expensive and could cost a plan up to $300,000. And we've seen plans for a member on dialysis spend over $1 million on a member before engaging with us. Very commonly, it is a top 10 plan. I would say for a lot of the communities we work with, prior to us getting involved, it's a top 3 expense. And dialysis is incredibly expensive. So ideally, what we want to do is take a preventative approach and prevent as many members from advancing into that stage of chronic kidney disease. And some of our solutions, we're saving members we're saving health plans 70% on average on dialysis, and that's when compared to network discounts. And then we also provide additional savings by helping prevent members starting dialysis in hospitals, as well as delaying, and this is where that preventative focus on today's presentation and conversation is going to be about, is we really want to delay for various reasons. One is cost, right, because it helps the plan, but obviously what's most important and endearing to all of us is going to be the health of our community members. All right, so the prior slide really kind of focused on U.S. population as a whole. I want to focus on how kidney disease specifically focuses on Native American and Alaska Natives. So one component is understanding is what causes chronic kidney disease. And chronic kidney disease very rarely happens on its own. Normally, there's other factors that are driving the advancement of that disease. One of the most common ones being diabetes, other one being heart disease and hypertension. So we have seen in the last 40 years an increase among the whole population for type 2 diabetes. A lot of that has to do with lifestyles, diet. About 40 plus years ago, high fructose corn syrup became a mainstay of what's in prepackaged processed foods. That definitely doesn't help. High sugar sodas, things of that sort are driving the adult population into type 2 diabetes. And that's a pretty large driver of what's driving chronic kidney disease. Other challenges in general is that for the Native American population, we see that end-stage renal disease is 3.5 times greater than white Americans. And I do want to point out that that's the average. I would say with a lot of the groups, when we start working with them, a lot of the communities we start working with, we'll see end-stage renal disease be six times greater. So 3.5 is really an average, but we've seen significantly greater numbers than that. And that's that's basically why we created our care management program several years ago, is to prevent end-stage renal disease. And then there's challenges, outside of diet, there's challenges, access to care. A lot of tribal communities may be rural or isolated, and while they may have clinics on site, there's still all the tools that are necessary to help care for our members are not always present. Now there are risk factors related to chronic kidney disease. I did talk about lifestyle is definitely one. Unfortunately, also genetics. So we have African Americans, Hispanics, Native Americans, Alaska Natives. We're simply at greater risk of developing kidney failure. But then the challenge really with chronic kidney disease, and as I noted earlier, very few folks are aware they have chronic kidney disease. Over 90% that have it aren't aware, is that it's a fairly asymptomatic disease. Until someone's in much later stages, they're not even aware of it. But there's, the only way to really know if you have it is through testing. Some other risk factors are diabetes, high blood pressure. If you have one of these two, very likely, very high possibility that someone has chronic kidney disease as well. If you have both, even more so likely. Heart disease and family history. I would say from being all healthcare leaders within tribal communities, I would say to a certain extent, I wouldn't be surprised if if anyone in this room has not been touched in some way or another by end-stage renal disease or chronic kidney disease, either directly or indirectly from a family member or friend. So this kind of focuses on the earlier slide. As I noted, 37 million Americans with chronic kidney disease. Early stage, what we call stage 1 or 2, and I'm going to touch base a little bit on that later, is that most folks, over 90%, don't know they have it. But even those that at the highest risk level, which is going to be stage 3B and later, almost half of those folks don't know they have chronic kidney disease. And the reason that that's important and why it's important for us to be aware is because we need to intervene sooner than later. Most folks that do find out they have chronic kidney disease, 80% of the time, they find out once they've started dialysis. They've reached end-stage renal disease, they weren't aware of it, or if they were aware of it, they weren't managing it properly, and they wake up in the hospital, they were unconscious, it was emergency treatment, and they wake up and now they're on dialysis. So part of our program is to prevent that. So how do people... Janet, can you repeat the question? I was looking at.
Yeah, I just thank you for this slide. And it's really sad that people find out about kidney disease at a later stage, but how do people typically find out that they have issues with their kidneys?
So, I mean, at times, normally they won't find out by design, the way, let's say, if you're not getting a kidney lab, if you're just getting a standard lab, the way our kidney health is really identified is what we call a glomerular filtration. You don't have to remember that. It's called a GFR. I think the next slide will cover that for us. And
Awesome. Thank you. Thank you.
You're welcome. So this kind of ties in to your question. So part of the challenge here is, now if we look at the various stages of chronic kidney disease, when someone gets a traditional lab, if you look at stage 2, you see GFR of 60 to 89. And that's how well our kidneys are processing and cleaning our blood. So quick bio lesson, what do our kidneys do? They remove toxins from our bloodstream, they balance water regulation, they balance minerals. And that the toxins that it cleans out is excreted to our body through urine. So ideally, we want to be over 90 to 100 GFR, which is, your kidneys are working as they should, really healthy kidneys. There are other factors as we age, genetic factors that potentially decrease kidney function. Like everything else in the body, our muscles don't grow as fast, get as strong. We lose some cardiovascular health as we age, slight. But obviously, if we take care of ourselves, good diet, exercise, a lot of things that help prevent diabetes, hypertension, also help prevent chronic kidney disease. But the challenge is that people don't get the diagnosis, to answer your question, is until they get a lab, and that lab shows that their GFR is under 60. And then it doesn't always get caught per se. And number one, we're not always getting labs as we should once a year. Some folks, especially with the recent pandemic, a lot of folks may have missed 2 or 3 years of labs. So if they were at 61% GFR at state or early stage 2, then they were, they go 2 or 3 years. By now, they could be stage 3, and they haven't done anything proactively to manage that. And that's where we really want to kind of focus on today's discussion is, managing and helping improve health and delay the advances through the stages, and potentially also reverse the stages. The kidneys are very unique in the sense where you could actually measure the health on a numerical level versus our heart or other organs. And we definitely want to prevent the final stage, which is kidney failure. Kidney failure, in order for someone to stay alive, they will need a transplant or be on dialysis in order to stay alive. Otherwise, kidney failure, chronic kidney disease, end-stage renal disease is a life-ending disease. So we do have tools, and I'm going to address some of those tools, kind of understanding that, everyone is not going to, if you have 2,000 members in your community, you're not going to be able to say, everyone go get a lab or go get a kidney lab. We do have tools to help identify members sooner with those and help address those challenges sooner versus waiting for folks to get the appropriate labs and the appropriate diagnosis. If there's any other questions, please let me know. So I'm going to show this case study. I did see some folks from Firekeepers have registered. I don't know if they did on today's call, but they're a great partner of ours. They've been a partner of ours for 5 years now, and we have their great case study and demonstration of what a program like ours how has it impacted their community. For one, dialysis, or when a member reaches end-stage renal disease, is incredibly expensive. So for community members, for citizens, there are some IHS programs, and depending on plan design, there may be opportunities to get savings there. But wherever there's gaps and opportunities for savings that a plan or a community may not be experiencing, we're present and we're able to help those communities lower those costs. So initially, Firekeepers has reached out to us, or their consultant reached out to us. Doug Ream, I don't know if he's on the call, but he reached out to us, knew about our program, said, hey, Renalogic, we have a group, members costing nearly $1 million a year. We need to get this under control. So we did that. We were introduced into the program. We started managing the costs related to this member, and we helped drive down that cost over 87% to the plan. At the same time, we also introduced our Impact Care program, and the focus of the program is, as I noted earlier, is to help manage those folks that have chronic kidney disease, help them get healthier. So from our nurses aspect, from the teams that Brittany works with, their focus is, not on saving money, and that's part of the thing is, their focus is on driving health, improving health for those members, and helping those members. Now, a good side effect per se of getting your members healthier is that you're also able to drive down costs to the plan. That money then could be reinvested into the community, expand on the existing programs. So that creates opportunities. And the best part is you have healthier members, you're reducing the amount of members that are advancing in, through the stages of chronic kidney disease, as well as advancing through other disease states, hypertension and diabetes, for example. In this particular example, as members' health started improving, within 12 months, we saw that on average, members were costing, or there were savings of $1,300 a month per member, and that's claims cost. So that means less dependence on medication, less visits to the emergency room, less visits to urgent care, because the members are simply healthier, so they're less dependent on getting medication or being sick. Overall, that helped drive nearly or over $500,000 in savings to the plan. And once again, that's money that can be reinvested into the community and reinvested into the plan. And it's one of the few places where, when we look at the cost of healthcare year over year, it's double digits. It's 8%, 12%, 15% increase in premiums, increase in claims. This is one of the few areas where you could actually help drive the cost down, and the program pays for itself within its first year. And actually, just for the Impact Protect, it pays for itself immediately when you factor in the savings there. Okay, so I'm going to cover what the Renalogic process looks like. As I noted, we are a complete program for renal health, for kidney health. Before I get started, was there any questions from the group? Okay, so we take various approaches in managing chronic kidney disease. One, first of all, understanding that it is heavily underdiagnosed, we have developed an algorithm, an analytical tool that helps identify, right? So we have this big gap, 96% of people that either don't know they have chronic kidney disease or lack the appropriate diagnosis. We have 48% that are in these later stages that lack the appropriate diagnosis out there in the community. So this algorithm actually finds those folks. And I'm just kind of curious, I don't know if you could do a show of hands, and it would surprise me if everyone said no, or unless they have a program like ours in place, is how many organizations actually have tools to help identify diseases that aren't even diagnosed yet. I would say very few do. We've had a lot of interest in technology by itself from other healthcare organizations, just for the software itself. We have Impact Care, which Brittany's going to expand on, as well as Impact Advocate, and Impact Protect I discussed earlier as far as how we help drive savings on dialysis. But the focus today, again, is not on dialysis or end-stage renal disease. The real focus is how do we help the community prevent the advances through those various stages. So I see another question here. And then
No, Ed, it's just me.
okay.
I'm always chiming in. I just said, I working in HR, for an organization and with a benefits team, we would do claim analysis, but I wish that there was more tools back in the days. And I think now in regards to health and wellness, it's how can an organization, do they have proper tools? What things are they utilizing for their staff to have a healthy lifestyle? So wish I had tools back in the day.
Yes, and we're glad to have them, and we've had a lot of interest, like I noted, on these tools. I know AI is a big buzzword right now because of things like ChatGPT, but we've been developing this as long as I've been here, well over 4 years. The company's been developing this and continuously fine-tuning. It is over 97% accurate in identifying members that have chronic kidney disease without a diagnosis. So that's the slide I have right here is the Impact IQ. So we're actually able to identify, that 97%, that 48 or 96%, excuse me, that 48% of the population that lacks that appropriate diagnosis. This helps find those folks. So we're not waiting till a claim comes in. We're not waiting for an emergency room visit or a specific claim to identify it. We're finding it beforehand. And the algorithm kind of works through understanding what those other disease states that tend to drive chronic kidney disease. It's looking at a combination of 40,000 different factors in identifying those high-risk members. And this helps early stage, right? So we catch someone early enough, we prevent that whole, we help prevent and manage those members from it continually advancing into those mid to later stages. And then even with those mid to late stage members, we're able to manage their health better. And in several cases, we've been able to actually reverse their trajectory through chronic kidney disease. More like outliers, but seeing members that were stage 4 improve to stage 2. And it's not uncommon for us to get members that are in stage 3 into that 1 to 2 range. And then I will hand it off to my colleague Brittany, and she's the best person to speak to, what that member experience looks like and what Impact Care does for our communities.
Thanks, Ed. My name is Brittany Morris. I oversee the Member Services Department at Renalogic. We are responsible for the clinical review portion of Impact IQ and then our Impact Advocate program. And today I get the pleasure of speaking about both of our clinical programs, Impact Care and Impact Advocate. So my team, the Impact Advocate side, is made up of nurses with a background specifically in dialysis and end-stage renal disease. One of our nurses actually came from one of the large dialysis organizations, so she's really well positioned to understand the member experience for late stage members, which is amazing. The Impact Care team is also nurse led, and those are nurses that are certified diabetic educators, other subject matter experts in chronic disease, which really positions both teams well for what they do. So I'll start with Impact Care, which is our preventative program. And at Renalogic, we don't believe that end-stage renal disease is inevitable for every member with chronic kidney disease, including some late-stage members. So we have a 99.7% success rate in avoiding progression to kidney failure, so delaying that end-stage renal disease for our participating members. And then just about a 90% reduction in both hospital admissions and ER visits. Those numbers are amazing, but what I really want to focus on in the lens of today is how we do what we do. So the narrative behind how we achieve those results, and specifically how we achieve them in Native American communities. And the way I'm going to illustrate that is by some lighthearted poking fun at some of the buzzy terminology we use in the health and wellness industry, starting with a concept I'm sure that many of you as HR professionals in Native American communities have been sold by other vendors, which is the concept of building trust. So if we just build trust in these communities, we'll be able to achieve outcomes. And I think as healthcare professionals, when we talk about building trust, what we're really saying is I'm going to say the right thing to my member, and from then on, they will believe me and they'll do what I say. And that is not an effective long-term way of seeing outcomes for human beings. What we really want to do and what we really need to be talking about is the concept of building mutual respect, because mutual respect places a member's cultural preferences, social, financial, health literacy needs, and just overall knowledge of their healthcare on the same level as their clinician subject matter expertise and knowledge. And that fosters mutual decision making. So a method of care where the member is deciding on the best path for them rather than being told exactly what they need next. And when I look through member stories and chart reviews and the various pieces of information I look at, I see a pattern of when that mutual respect is not established between a member and their provider, we see those negative outcomes. So Ed referenced the 3.5 times higher prevalence of end-stage renal disease in Native American communities. That's very likely related to a lack of early diagnosis. And we see lower transplant rates and higher rates of emergent start. And that's because not another buzzy term, not related to a lack of compliance or adherence on the member's end, but related to not having an understanding with their provider of what's important to them and what barriers they may be experiencing. And I'll give a tactical example. So we have a member working with one of the Impact Care nurses in the Pacific Northwest, part of a tribal group, who had stopped seeing her primary care provider. And when the nurse reached out to the primary care provider, that provider identified it as a lack of adherence on the part of the member. And when we use terms like compliance, adherence, those aren't terms that foster a sense of mutual respect. So when the nurse got to know this member and understand what was going on, the member had decided to stop seeing her primary care provider because she was going to these visits and reporting some really concerning symptoms that were really interfering with her daily life. chiefly just extreme fatigue and exhaustion. So that makes it difficult to work, difficult to spend time with your family, do any of the things that you really want to do. And the nurse, being a certified diabetic educator, recognized the list of symptoms really sounded like undiagnosed diabetes, but her provider wasn't taking the time to address those symptoms specifically. Her provider was kind of generically saying, it's your weight, you need to eat better and exercise, which really hard to do when you're exhausted all the time. So the nurse was able to help that member establish with a new primary care provider and get a referral to an endocrinologist, where she ultimately was diagnosed with diabetes and able to manage those symptoms by managing her diabetes. That long story to show that without that intervention, it would be a very different story for that member. And with kind of the snowball effect of chronic disease, that member would continue to get worse if no one was there to advocate in the way that that member needed. So what this provider saw as an adherence issue, our nurses were able to see as a barrier. The member was not getting what she needed from her provider, so of course she's not going to continue to go to those visits. And tactically, we approach care management in a few different ways. So we work with the on-site providers and existing infrastructure. So HR professionals work really hard to set up really great infrastructure for those members. We make sure that members are utilizing the resources available to them within their program. And then we conduct our outreach process in a way that accounts for members' preferred language, best time of day to call them. So we look at kind of most common work hours within the community and the method of communication that works for them. So if someone prefers written communication over a phone call once a month, we're going to meet the member at the communication method that works and sees results. And it sounds kind of silly to someone who has not had experience with texting in healthcare, but you would think it wouldn't be incredibly effective. But I see texts between our nurses where a member gets done with a provider appointment, quickly texts their nurse how excited they are that their GFR was significantly lower or their diabetic A1C was significantly lower. So they still get a really robust experience, even if their preferred communication method is not talking on the phone. All right, we already moved to the Impact Advocate slide. So this is actually the program that I oversee. So Impact Advocate is a specialized program for our latest stage members with chronic kidney disease. So we get members when they are at CKD 4 or above, whether they progressed there or they came to us in that disease state. And the reason we have kind of a program broken out for them is because their needs are a little more unique than members who are proactively addressing chronic illnesses. So things we're talking about are treatment preparation, treatment options, and then ultimately, when a member progresses to end-stage renal disease, Medicare education. Treatment preparation is incredibly important, and this is another area where we see a lot of complaints from providers about compliance or adherence. So we have another member, member of a tribal group, also in the Pacific Northwest, I believe, actually, who, when the nurse reached out to her nephrologist, the nephrologist said, oh, she's refusing to start dialysis. She needs to start and she won't get her access placed. She won't start treatment. What the nurse learned from speaking with the member is that this member had a huge family vacation planned coming up, and she was avoiding her nephrologist because the nephrologist was kind of presenting it as all or nothing. You have to start dialysis right now, because she wanted to get that done with before starting treatment, which to me, that's completely fair. Someone should not have to miss out on an experience like that because of their disease state. So the nurse was able to work with this member and find ways to preserve her remaining kidney function in order to attend this vacation prior to treatment start. She was actually able to prolong dialysis for 4 months later than her nephrologist had initially recommended. But what we also did was make sure that this member did have her dialysis training and did select her treatment modality prior to leaving on that trip and had her access placed so that she could start right when she got back. So we were able to kind of break down that barrier of reluctance to talk to the provider and do the things that would avoid an emergent start for her long term. We educate members on treatment options. So a lot of times members hear one option, which is in-center hemodialysis 3 times a week. And we like to make sure everyone is aware that there are other treatment options available to them. So peritoneal dialysis, which allows a member to dialyze all the time and still go to the activities that they want to go to, continue to work, do the things that are important to them. Home hemodialysis, some people like to dialyze overnight in their home versus in-center. We essentially make sure everyone has a fair and equitable chance preference at choosing the treatment modality that they would like most. And then we work on enrollment on the transplant list. Any questions on either clinical program? Awesome. Ed, I think we can move on to the last one. Right.
Brittany, was there anything you wanted to cover on this? I think I probably should have, I don't know if I was supposed to move the slide a little bit sooner, but I think you really
This was
touched.
really tactical. I don't think we really need to stay on it long. So again, I know this presentation will be recorded. Feel free to look at it later. So these are just some of the tactical ways that we both prepare members for dialysis and end-stage renal disease, and then also the actions that we take once a member is enrolled in the Impact Care program. So things like outreach and onboarding. We try to get a complete picture of the member's health. So we request medical records, we take the member reported information, we look at their claims review, and then a lot of what we do is kind of consistent clinical intervention and care management and health coaching that you're used to seeing, but we do that through the lens of mutual decision making with the member. So what are their goals? What's important to them right now? And how do we get them there? And how do we get them there using the tools that they have available already, or advocate for them to get access to better tools in the instance of the first member that I talked about.
Great, thank you, Brittany. And then, yeah, and I just want to kind of emphasize, so with the Impact IQ, which we're helping identify, part of that process, part of that member activation on onboarding process is validating and getting the appropriate diagnosis. And that's where we have the data and validation that, that our program successfully helps identify that gap by over 97% accuracy, which is a very important gap when you factor in that over 90% people don't have the correct diagnosis. And then we already touched base on the savings with Impact Protect, but this is a program. There are other, there's other ways to help drive savings and Medicare-like rate programs through or for citizens, for the members that live, within the sovereign nations. But Impact Protect also helps protect those members that are not citizens, that are employees of tribal enterprises. So we're helping drive down savings and improve those costs. And once again, if we could, we're saving a healthcare plan, 100,000, 200,000, or even millions of dollars. That's money that gets to be infused back into programs, whether it's to build a new clinic, whether it's to hire more staff, whether it's to expand existing programs, improve mental health treatment, things of that sort. That money is saved is always a great way to reinvest. And as I noted previously, both programs basically pay for themselves fairly soon. So appreciate the time. Were there any questions from the group? And then I do want to recap the benefits here, right? So, one thing is that we identified today is we know that chronic kidney disease is heavily underdiagnosed. So finding chronic kidney disease within the population before it's too late, this helps promote, member health, helps prevent members advancing into dialysis. As I noted, the health plan savings we can reinvested, and then also extension of your existing resources. So I don't know if I missed it, Brittany, but one thing that when we are working, we're onboarding new partners is that we want to find out, is there a clinic on site? What else do you have to offer to your program? So our nurses will be informed of everything that exists within that benefit, right? So they're providing their services and helping coaching that member, but also if there's needs for mental health, smoking cessation, alcohol, they're coordinating and helping coordinate that member with other features that would help that member's health. And the other thing, having HR leaders here and healthcare leaders is that for the enterprises, I know from from San Antonio and from Hawaii last year that a lot of discussions was in recruitment, right? It's getting hard to get talent, right? So having a program like this could help benefit, number one, retention for your existing employees, but then also is a benefit feature that could potentially help, in any of your recruitment efforts as well. And as I noted, I look forward to meeting you folks. And if you identify a need within your population, please reach out to me directly or to your consultant. As I noted, I pretty much work with all the consultants that are proactive in NAHARA, and I look forward to meeting everyone in a few months.
Ed, it's Janet.
Yes.
Would you be, I know that I'm recording this session, but
Sure.
would you be able to share your presentation if we had someone to email
Sure.
you?
Yes. I'll put this in a PDF format so it's easier to email, and
Okay.
I could email it to you or whoever you need me to email it to.
Okay, awesome. Well, for those who are on the call right now, Ed's email is egonzalez@renalogic.com. I would email him directly. I really liked your slides that you had. You had some really great data. We have board member Sir that has a question, or I'm
Yes.
sorry, a comment, right?
Yes. Oh, thank you, Ed and Brittany. Your numbers look amazing. I'm really impressed. This looks like a great program, and you know, this is something that I've experienced myself. My husband, who passed unfortunately last year, he passed from a heart attack, but he had health issues. He was a diabetic, double amputee. He was looking at, towards the end, we had actually met with DaVita Dialysis. He was looking at possible going to treatment. So I can't tell you the impact that it has, you know, psychologically, knowing that you're going to have to deal with that. So, you know, I think programs like this are great. And I always look at the root cause, like, you know, diabetes is such a terrible disease. And I serve on our health commission. So that's one of my, you know, I guess, focuses is, you know, diabetes. It just leads to so many other things. Yeah, also, though, I do have a success story. I have a younger brother who just recently had a transplant.
No.
He had been on dialysis for 5 years, had been on the list for like 3 years, and he actually just had a transplant like in January, December or January, and he's doing great. He's doing really good, and so I'm just thankful when I see him and he's healthy and he's walking around and he, you know, but it's just such a terrible, and he's diabetic as well. So, you know, it's just, and it's so prevalent in our communities. It's just one of my focuses. So I appreciate, you know, any type of, you know, this is something that would help. And I like that it's cultural, you know, it could be culturally specific. I love that, you know. I think that's number one in our communities is the people that work with us need to understand our culture first, you know, first and foremost. So I appreciate you. I appreciate your presentation today. And this is certainly information we can share. Look forward to seeing you at the conference and sharing your information with our group and our membership. And yeah, just appreciate you. Thank you so much for today.
Appreciate you, Dorothy, and thank you for sharing such a, you know, personal story, and sorry for your loss. We're glad to hear that your brother was able to get a transplant. That's such an important part, and I know that Brittany and her team, that's a big focus of ours, is helping members get transplants sooner. Because realistically, while there's no cure for chronic kidney disease, that's going to help ensure that your brother's going to live a lot longer versus had he been just on dialysis.
Transplant is a huge investment that Renalogic is making this year. It's really important to us. If we could put our Impact Protect product out of business, we would be very happy if everyone could get the transplant sooner. So congratulations to your brother. That's awesome.
Okay.
Thank you, Dorothy. Ed and Brittany, thank you so much for this topic. It is as well, it's an important topic. It's dear to my heart, kidney disease, and to hear all these wonderful things that we are doing now. We've come a long way in HR and just, you know, having a benefits team that just were administrators and having professionals and organization working with partners to better our tribes, our communities, and our workforce. So hats off to y'all, and thank you so much for presenting today.
Thank you. It's always a pleasure. Thanks so much.
Thank you, everyone, for joining us. And we hope to see you at our Mental Health and Wellness Summit and our annual conference. Have a great day. Thank you.
Bye.